Hey guys, welcome to my channel, Medical Assistant with Miss K. If this is your first time here, welcome. My name is Kendra, aka Miss K. I'm a medical assistant instructor, and I have been in this field now as of June 2023 for 18 years now. So welcome, I'm glad you're here. If you are a returning viewer, hey guys, I'm sorry. I know it's been a long time. It's been a few months since I've uploaded a video. I am sorry. I've had a lot going on. For those of you that know me, you know that I have a teenage daughter. And so she, as of June 2023 today, she just went to prom last weekend. She's about to graduate high school next week. I know many of you guys watching, prom season is probably over for you, but here in the DC area, in DC anyway, it's later. It tends to be later than everybody else. So everybody has been done with prom. Some people went to prom last year. We're still in prom season. I'm actually going to a prom send-off today after I record this video here. And then graduation, right? Most of you guys have already had your graduations and things like that. Not here in DC. But anyway, so I've been busy with that. And you guys know, I told you, I'm outside of teaching medical assistant. I do so many other things. I'm a travel agent. I am an author. I have a lot going on. I did a video a while back on multiple streams of income and why it's so important. So if you haven't check that video out, make sure you check it out, because if we haven't learned anything else these last few years, you need multiple sources of income. Nothing is guaranteed. But anyway, we can talk about that again later. But anyway, I wanted to go ahead and do this video. I've been getting so many questions in the comments. I've been getting emails and things like that, and I try to respond to every single comment. I apologize if I miss you. I try to at least heart it. If I don't respond to it, I at least try to heart it. But questions, I always try to get to those. So if you're seeing this video and you just email me anything like that, just give me a minute. I'll get to them. But there's a few questions that I wanted to address in this video. So I'm going to try not to be long. I don't know if I'm going to make this video separate videos. I don't know. I'll see how long it goes. I may make this video separate videos for each question, or it may just be one video. I don't know. We'll see. But anyway, the first thing that I wanted to address was, when is the new NHA material go live? So those of you know, NHA gives the CCMA exam as well as the CMAA. They do phlebotomy, EKG, and all of that, but I focus on CMAA and CMA because those are the courses that I teach. I teach medical assistant and medical office. So people have been asking, when are they going live with the new material? So you guys know, back in 2022, they did put it out there that they will be publishing new material in 2023. So we've been waiting and wondering. But we did recently find out that they said that they're going to go live with the new material in January 2024. So we still have a little bit of time, right? And so once that material publishes, I will do more. I will do new practice test question videos and all of that. But I will say this, because things like, vital sign ranges, common blood test, those ranges and everything will still be the same. Certain scenarios, what you would do in certain scenarios, those things are going to stay the same. So, those videos that I have, they'll still be good. They'll still be watchable. They'll still be, relative to even the new test. And what I believe, and I'm not sure, so do not quote me, this is just my thoughts. I believe that the new material is going to, of course, be updated because, in healthcare, things change, right? Guidelines change. But I definitely believe that they're going to add, since we've been in a pandemic these last few years, and I know now that they've declared that we're officially out of the pandemic, but I really believe that they're going to add guidelines that has come about in the last few years. I really believe that. And so I will do new videos, but like I said, those old videos will still be helpful. I know I'm going to get that question, so I wanted to address that. But to answer the question, when does the new material come out? They have said that they will be published. The new study materials and the new test will be published January 2024. Okay, so I've gotten this question in the comments, and it is something that I've talked about in my externship video, do's and don'ts on externship, and while you're in your externship. But I do want to address that here because I had someone in the comments mention that she's on externship, and her the coordinator, whoever she's working with on her externship site, has been signing her off on things that she has not done. And she wanted to know what to do about it. Now, this is the thing, and as I mentioned in the externship video, while you're on externship, do not be afraid to speak up about what is right and what is wrong, right? So if someone has you doing something, let's say somebody has you doing something outside of your scope, which has happened. I've had students that tell me that, they've had people asking them to do things that they know are outside of their scope, nursing duties that are outside of the scope of a medical assistant. And one thing I want you to remember, how we know that we are covered under the provider's insurance, malpractice insurance? We're only covered if we're acting within our scope. So if you're doing something outside of your scope and something happens, guess who, and the patient needs to come after somebody, guess who they're going to come after legally? You, right? You're only covered when you are within your scope. Know what your scope is. Now, one thing I do know is that our scope can be different from one state to another, right? So here we can give injections. Medical assistants can give injections. In some states, they can't. So know your scope, okay? So if someone is trying to get you to do something that is outside of the scope of a medical assistant, kindly say, you know what, no. And let your school know that the site has you doing this or trying to get you to do this, right? Also, so the person in the comments said that the site is signing her off on things that she's not doing. Now, for some people, they may be okay with that. They may say, well, you know what? I just want to get my hours. Just sign me off. But a person who has integrity, that knows that we should not be lying about this. These are things that I went to school for. I want to actually do them. I went to school to learn how to check blood pressure. I went to school to learn how to draw blood and give injections. I don't want to just get signed off on it. I want to actually do it. You speak up for yourself and you let them know this is not right. And you know what? You let your school know, the externship coordinator, your dean, whoever, your program director, whoever is responsible for overseeing the externship sites, let them know, because that school is in a contract with that externship site, right? That site has a duty to give you what you're supposed to get, right? Whether it's having you doing some filing or, vital signs or whatever, they have a duty to make sure that you're doing what you learned. The purpose of externship, of course, is to get a job. You definitely want to get hired, but it's hands-on training. And so we don't want to be in a situation where we're getting signed off for hands-on training that we're not getting. It's not going to help you. If you are one of those people that's okay with just getting signed off, it's not helping you because you're not getting the practice that you need. So if this happens to you, which it does happen, I've seen it. I've seen it with my students. I've seen it years ago when I was on externship myself. And so I know it happens, but don't be afraid to speak up for what's right. It's not fair to you that you don't get to utilize the skills that you were learning in school. Another question that I got in the comments, somebody was concerned that English is not their first language, and she wanted to know what she should do. Now, this is a very common thing because I do get a lot of students who are bilingual and English is not their first language. And I just usually tell people to use it to your advantage because, when you're bilingual, it stands you kind of stands you out because a lot of places need that. They need people who speak multiple languages, right? So I get a lot of students who are Spanish speaking in certain areas in our area. I live in DC, in the DC area, DC, Maryland, and Virginia. And so there are certain areas that we know are primarily Spanish speaking, is primarily Spanish speaking patients, right? And so they tend to apply for jobs in those areas where they know that they're going to be most needed, right? So I say, look at your city where you are. What are those areas in your city where that population is that speaks your language, and try to get a job in that area. So I had a couple of students who are from Ethiopia. Both English is their second language, right? Both of them, I think one has been here maybe 4 years, another one maybe 2 or something like that, maybe not even something like that. And so there's an area in DC where that population is heavy, where they have Ethiopian restaurants up there, and so I told both of them to look in that area. The office is in that area, the doctor's office in that area. I'm pretty sure they would love to have them there because then they can easily translate for those patients that come in there. So just, I understand how it can be, I can understand how you can be worried about that. And I don't want that to make anybody feel defeated, right? It's okay. Use it to your advantage. You can be a translator, like I said, and you can be open with your patients. If you have an accent, you can let your patient know, like, look, I just want to be honest. I do have an accent, so I don't mind repeating myself if you don't understand me. You can be transparent with your providers, your nurse managers when you go on externship, and let them know English is not my first language, so I may have some questions. Don't be afraid to ask questions, right? Don't be afraid to ask, what does that mean in English? Because like I said, I get a lot of students, they have to, ask several times, like, what does that mean in English? And so it's okay. So anybody watching this and this is your concern, it is okay. And I hope that what I've just said was helpful for you and encouraging for you. You are definitely needed, trust me. Okay, so another thing I wanted to address in this video was a question I got about resumes. A person wanted to know, should I include my retail jobs on my resume? So, and this goes for any job, not even just retail, but any job. So let me just go ahead and address the retail thing. So definitely, yes, include that, especially if you've had no other medical experience, right? Because when you're working in retail, you're working with people. So those same customer service skills that you needed when you were ringing people up and answering questions, those are the same customer service skill. It's called a transferable skill. Those are the same customer service skills that you're going to need to provide quality patient care to your patients, okay? So definitely, that's actually going to help you out, because then your employers, your potential employers, will see that you are used to working with people. And that's actually one of the things you can include when you're speaking in an interview or even on your cover letter. Like, although I don't have prior medical experience, I have, 4 years of working in customer service. It translates. Like, even I tell people who work, I've had students who work in a daycare, they're like, Miss K, I've never worked in a daycare. I've never worked in a doctor's office, but if you're working in pediatrics, right? If you're trying to work in pediatrics and if you worked in a daycare, they see that you're used to working with children, right? So those transferable skills, customer service, answering the telephones and working with people, definitely include that. The only time I would say you don't have to include it is if it's not relevant. Like if you were somewhere, let's just say maybe a month or whatever, and you have other employment you can put on your resume, then don't include it, right? So if you have worked in the medical field for maybe the last 10 years or even the last 5 years, right? You may not necessarily have to put your jobs prior to those medical assistant jobs, right? You may not have to put that. And so they just want to see, really, this is what I say. And some people may disagree, because this is why I always tell people when I get questions about resumes and cover letters on my channel, I always say, talk to your career services counselor at your school, because they may say something different. For me, I tend to tell my students, those last 3 jobs, especially if they were, each of those jobs lasted a few years, that's all you need is the last 3. With some people, they may go back their entire history. So that's why I always say, check with your school career counselor and see what they say and go by what they're telling you, right? Because some people may say something different, right? Some people say don't include your high school on there. Some people say include it. Some people say, other certifications that you have that have nothing to do with the medical field, don't bother, right? And so it just kind of depends. Everybody's may have something different. This is just what I say. And I also think that you should have a medical assistant resume separate from other resumes. So I had a student who, she had worked in a post office for like 20 years. And so she said something about maybe going back there. So I told her, just have that separate resume for if you want to go back and do something within our local government, have that resume, right? And then the medical assistant resume, have that resume, right? So sometimes that may be a thing too, where you have different resumes. And then also your resume is a standing document, meaning you're always going to add to it. So make sure as you're learning new things, whether you're in your externship or at your actual job, every time you learn something new, add it to your resume. I usually recommend my students to put it on Google Drive. If you have a Gmail, you have a Google Drive. When you have it on your Google Drive, you can constantly update it, and then you can just save it as a Microsoft Word document or PDF to send out to employers, and you never lose it, right? So I had a student the other day, couldn't get into her computer. If you have it on your Google Drive, you can put it up anywhere, even on your phone, because there's a Google Drive app. Google Documents, Google Sheets, or anything you do on your Google Drive, you can actually put it up on your phone and any other device. So I hope that this was helpful. If you happen to have any other questions, let me know down below. I'm going to try I think I may have said this before, but I'm really going to try to do better with uploading more answers to these questions that you guys get, because I know that many of you are going to have the same questions because I'm getting some of the same questions over and over. So I'm going to try to do better with making a video as I'm seeing the same questions over and over. Also, I do have a Facebook group now. Currently, it's called Medical Assistant with Miss K, but I only called it that as a start. I was supposed to change it. I'm just still trying to finalize the name. I'll leave the link below just in case by the time you see this video, the name has changed, because I don't want you to go look for Medical Assistant with Miss K and then it's not a group because I've changed the name. So I'll leave the link down below if you're interested in joining the Medical Assistant group. It's for people, anybody that want to join. If you're already a medical assistant, if you're thinking about it, if you're trying to pass the test, you know, they're sharing notes and stuff in there. So just make sure you have a profile picture and make sure you answer the membership questions to get approved into the group. I do have some moderators helping me with that, with approving people. And so if you don't have a profile picture and if you are not answering the questions, you won't be admitted into the group. So, but anyway, thank you again for visiting my channel. I hope that you're blessed. And also, I'll leave my link to I have a couple other YouTube channels. So I mentioned that I'm a travel agent as well. So I have a channel that I'm going to start posting some of my travel videos over there. It's called Miss K All Over the Place. And the reason why I call it Miss K All Over the Place is because I'm literally all over the place. I do a lot of things. And I wanted to use that channel to be able to just post random things. Like if you do go over there and check that channel out, you'll see it's just random videos, lashes, hair. I'm going to be posting my trip videos, travel agent stuff over there, travel videos and stuff like that. So if you're interested in seeing me be all over the place, you can go check that out. But anyway, thank you for visiting my channel. Be blessed.